Your Skinstructors tip of the week. Let's be real for a second. How does your neck feel right now? If you're a pro, you've probably spent the last 4 hours hunched over a treatment bed, focused entirely on someone else's pores, while your own traps are screaming for mercy. Here's your reminder, your body is the most expensive piece of equipment in your room. Starting today, I want you to implement the 90-second reset between every single client. No, it's not just grabbing a snack or checking your DMs. We want you to step away, drop your shoulders, do a gentle neck roll, and stretch those forearms. You aren't wasting time, you're investing in your career longevity. A broken esthetician can't perform, so protect your tools. And here's the connection that most people miss. Chronic physical stress in your own body will also contribute to systemic stress. And systemic stress drives inflammation, which can show up as breakouts, sensitivity, and even rosacea flare-ups. So this isn't just about your neck. This is about your nervous system.
Welcome back to the Skinstructors. I'm Jolie.
And I'm Morgan. In today's episode, we're talking about stress, but not in a fluffy self-care Sunday way.
No, we're going deeper.
Yep, we're talking cortisol, inflammatory cascades, hormonal rhythms, nervous system dysregulation, and specifically how stress uniquely impacts the female physiology and female skin.
Because women's bodies do not respond to stress the same way men's bodies do.
And when stress is the root cause, not in the product, no amount of exfoliation is going to fix it, especially in inflammatory conditions like acne, rosacea, and pigment disorders. So let's start with biology. When the brain perceives stress, the hypothalamus signals to the pituitary. The pituitary then signals to the adrenal glands, and our lovely cortisol is then released. That's the HPA axis, and it's the body's central stress response system.
Cortisol is not the enemy. It's protective. It mobilizes glucose, increases alertness, and suppresses non-essential systems temporarily. The issue is chronic activation.
It is. So when cortisol stays elevated, we see a few different things in the skin. Increased sebum production, increased keratinocyte proliferation, impaired barrier repair, and elevated pro-inflammatory cytokines.
Which means more IL-6 or interleukin-6, a pro-inflammatory signaling molecule that tells the immune system to ramp up inflammation. Helpful short term, but chronically elevated, that's when we start seeing skin conditions flare up.
Yeah, and we also see increased TNF alpha, which contributes to redness, swelling, and tissue irritation.
And this is where we connect it back to rosacea, because rosacea-prone skin is already more reactive. So when these cytokines increase, we're not just seeing acne, we're seeing flushing, persistent erythema, and inflammatory lesions.
Exactly. So that inflammation is the common thread behind acne, rosacea, eczema flares, and even hyperpigmentation. So when a client says, I haven't changed anything, but my skin is freaking out,
your next question should be, has anything changed in your stress level? Here's a tip. If a client presents with sudden inflammation, acne, redness, sensitivity, without a product change, investigate stress before overcorrecting the skin. Let's go deeper into what stress actually does to the skin, because this isn't just you're stressed, that's why you broke out.
Right. There are very specific mechanisms happening here. So when cortisol rises chronically, it increases that adrenal androgen production, and that means that there's more oil stimulation at the sebaceous gland.
Yeah, and it's not just more oil, it's thicker oil.
I did not realize that.
I can feel it in my own skin.
All right.
When I get hotter, like I can tell that the oil's thicker. Like when my face is hotter.
I love that for you.
Yeah. Yeah, thanks.
Well, that makes sense because that increased cortisol is going to shift that lipid composition in the sebum. So it becomes more pro-inflammatory, and that means it's more likely to clog pores.
Yeah, so we also see increased keratinocyte proliferation. So the follicle is producing cells faster and more sticky corneocytes, slower shedding, and that's a perfect storm for microcomedone formation.
And those sebaceous glands actually have receptors for stress hormones too. So that means that your oil glands are literally responding directly to emotional stress signals.
Yes, and then we add delayed wound healing. Cortisol suppresses immune function, so when a breakout forms, it stays inflamed longer. PIH lingers, post-inflammatory erythema lingers.
And that's why stressed clients often say that this breakout looks worse than usual. It's physiology. Another tip here, if acne is inflamed, lingering, and slow to heal, consider stress as a driver before increasing exfoliation intensity.
Now let's talk rosacea, because stress is one of the most common flare triggers.
I love that. It's also one of the fastest.
Sure is. So when someone is stressed, the sympathetic nervous system activates. That increases vasodilation,
Which means that your blood vessels expand more easily. In rosacea-prone clients, those vessels are already hyperactive.
Cortisol increases inflammatory cytokines like IL-1 and IL-6, which amplify redness and papule formation.
And there's also a neurogenic inflammation component too.
Yeah, this is key. Stress activates sensory nerve endings in the skin, releasing neuropeptides.
So substance P is one of them. It increases vasodilation, mast cell activation, and inflammation.
So rosacea isn't just vascular, it's neurologic and inflammatory.
So that's why emotional stress can trigger flushing within minutes. I would even seconds. And if we treat rosacea aggressively without addressing the triggers, then we're constantly chasing these flares. During a rosacea flare, things that you can do as a clinician is decrease stimulation before increasing correction. So focus on calming, temperature control, and barrier support first. All right, so now with pigmentation. So chronic stress also is going to increase the systemic inflammation, which stimulates your melanocytes.
So even without UV exposure, pigment can worsen, especially in melasma-prone clients.
Sure will. Yeah. Stress also impacts estrogen and progesterone balance, which is going to play a huge role in pigment.
Add UV, inflammation, hormonal shifts, and stress, and you get stubborn pigment.
And for clients who are already struggling with rosacea and pigment together, that stress can amplify redness and discoloration all at the same time. If a client's pigment worsens without sun exposure, assess the inflammation and the stress before adding stronger brightening agents. All right, now as far as hormonal rhythm differences in women, so women operate on both the circadian rhythms and the infradian rhythms. It's that 28-day hormonal cycle.
Estrogen rises in the first half and progesterone rises in the second half. Cortisol interacts with both.
While chronic stress can suppress progesterone, create estrogen dominance, and increase androgens.
And when progesterone drops, we lose its calming, anti-inflammatory effects, including GABA support.
So now we see more anxiety, more inflammation, and more breakouts, and even increased flushing sensitivity in our rosacea-prone clients.
And this is why so many women say, my acne is worse before my period, especially when I'm stressed.
So this is where estheticians have the real power.
Because you can't prescribe medication, but you can influence the nervous system.
So when a client walks in overwhelmed, they're in sympathetic mode. Their cortisol is elevated, their inflammation is increased, and their healing actually slows down.
And for rosacea clients, this can mean immediate flushing, even before you touch their skin.
But when we focus on activating the parasympathetic nervous system, everything shifts.
Heart rate slows, blood pressure lowers, tissue repair improves.
So how do we as estheticians help them regulate? We have them slow down their breathing. We lower our vocal tone. We avoid rapid movements. We use warm towels strategically, and we keep touch very rhythmic and consistent.
Even 60 to 90 seconds of guided breathing can shift that physiology.
Yeah, you can literally reduce visible redness in the treatment room. So start rosacea or high stress clients with guided breathing, doing a longer exhale than inhale. And that activates the vagus nerve and reduces the flushing before treatments. So this is the hard truth. Sometimes the skin condition isn't causing the stress. The stress is causing the skin condition.
And this is especially true with rosacea and chronic inflammation.
Yeah, if we don't identify that, we keep chasing the symptoms, and we might be doing more peels, stronger actives, more correction,
which can further compromise the barrier and worsen inflammation.
Yeah. So what do? We educate, we ask better questions, and we adjust the treatment intensity.
Yeah, and sometimes we say, let's stabilize your skin while we work on internal stressors.
I love that. Because sometimes the most advanced move is actually restraint. Another tip here, when progress stalls, don't escalate. Zoom out, pause, look for internal triggers before intensifying your treatments. So this week, we want you to audit your consultations and add one question. What has your stress level been like for the last 30 days?
And for your acne, rosacea, or pigment clients, start connecting those dots out loud.
I love that. Thank you so much for spending your time with us today. If this episode helped you think differently about stress and skin, make sure you subscribe so you never miss an episode.
Share this with another esthetician who needs to understand the root, not just the reaction. Follow us on Instagram at SDTraining and check out SDTraining.com for more advanced education.
And as always, don't hesitate to educate.